Buen día, mi nombre es Héctor Castro, director encargado del Departamento de Innovación y
A
Acceso a
very good afternoon. I'm Héctor Castro. I work with the department on programs of technologies on health and in Latin America and the Caribbean.
Acting Director of a new department, Innovation and Access to Medicines and Health Technologies here at PAHO. Just a reminder that we have interpretation. Just click on the button at the bottom of the screen for interpretation in English. Olá, bem-vindos ao nosso webinar de hoje. Lembramos que temos tradução simultânea para o português. Basta clicar no botão de interpretação do Zoom para isso. Este webinario está siendo grabado y será compartido en la plataforma.
This webinar is being taped and it will be shared on the platform of PAHO. And as I have mentioned, there will be simultaneous interpretation into English, into Spanish, and into Portuguese. All you need to do is to click on the bottom of your screen. We are very pleased because we are today launching the 2023-2024 series of seminars that will be the basis of the regional technology in Latin America and the Caribbean from the standpoint of public health. As you know, on the basis of one of the resolutions that were adopted by the member states, it was felt that it was important to strengthen the environment and productive capacity of each country. This was one of the lessons that was derived from the pandemic. And since we're going to be carrying out these webinars every few weeks, every few months, we will be looking very clearly at the network of different regional networks on public health and on the different aspects involved here. And we will be inviting everyone to share their respective experiences with us within the framework of the platform. What we want to do is to see how best we can push the development of vaccines and other issues in the region, and certainly the public-private relationships to boost access to technologies and sanitary issues in the region, and bring in other aspects that will be considered pertinent. As you know, Dr. Javas Barbosa Jr. is now our new director of the Pan American Health Organization, and he has been launched into a process of strengthening the organization to ensure that the regional platform for innovation and production of medicines and health technologies are really front and foremost in the agenda. And from the start of April, a program was, in fact, a department was set up precisely to that end. It has three components. The first is the unit that deals with quality and recovery in the whole issue of regulatory systems in the region. Another has to do with procedures and processes that have to do, again, with quality regarding to medicines or other issues that are bought on a rotation basis. And the second unit has to do with the unit to access to medicine or technologies that have to do with health, and that are very much linked on the policy set up for price, for technology in the sanitary area, access, as I said, to different equipment, to different medicines, tests and diagnoses that are carried out in vitro or anything to do with plasma. And finally, a special program that will be also part of the regional platform that is going to be the focus for innovation. And I'm going to give the floor to Tomas Pinto, who will be an important guidance today. And I'm pleased to give him the floor now. Tomas Pinto, you have the floor.
Gracias, Héctor.
Thank you so much, Hector. and a very warm welcome to each of you. As you know, this is the first webinar of a series that we have set up where we are focusing on how we can rethink this agenda of production and access to sanitary technologies, production and development of these in the Americas. What can we do to position ourselves better for the advent of some new pandemic that may be down the road? We know that different parts of the region have different strengths. This agenda, of course, highlights different challenges. One of them is the economic sustainability of these projects. The other is the importance of generating capacities. When we spot a high level technology field, we have to look at the different market situations and the need to adapt to them. All of this means that one has to be able to generate investment, to face risk taking, and putting together public policies that will take us where we need to be in the short and longer term. How do we plan to strengthen our specific risks? How can we also not forget our general ecosystem so that our countries can strengthen their productive capacities? On the one hand, one always thinks of, from an economic standpoint, perhaps, what can be done in terms of cost benefits. But we are looking at this agenda from a public health standpoint. That is a different vantage point. Aside from cost benefit and the economic advantages of a program like this, we need to bear in mind the cost of not having this program, because we don't want to be in the same position as we were last time when a pandemic caught us short. So we have with us Marcela Bistrutia, and numbers of others whom we will introduce little by little, and who are representing, of course, the different institutions that are going to be speaking, and we will introduce them and then allow them to speak. Javier, Javier Guzman is a director of the Program of Health Policies and Global Health Policies and main researcher, and Marcela Distruti. Speaking again of Javier, we know that he has helped more than 20 countries in Africa and Asia. He has he's a technical director of the program of medicine technologies and pharmaceutical products. He has been the general director of the Colombian Institute for Surveillance in Nutrition and Medicine. Marcela Distruti, another panelist, is a senior specialist in health and works in the Division of Social and Health Protection at the Inter-American Development Bank. She has a curriculum that is rather similar to that of Javier Guzman. They work together at the London School of Economics, and she's worked with Johns Hopkins. She worked for the Brazilian government. She's worked with the Hilton Foundation and has helped with countries in Africa as well as Latin America, and has worked with the office at the Dominican Republic and is now working with us at headquarters. Nicolo Gligo is a functionary, officer of economic affairs at the Division of Productive Development and Business Development at CEPAL, ECLAC. He has an MIT master's. He has 25 years experience in the development of policy frameworks, investment. He is a specialist in importation and technological development. He has had all different levels of responsibility in the Chilean public sector and has worked as a consultant for numerous international bodies. As you know, from this very broad brush introduction to these panelists, Javier Guzman, Marcela Distruti, and Nicolo Gligo, they all three have a lot to tell us. And during the pandemic, they certainly made a difference from where they found themselves. And that is why we're so pleased to have them with us to share their thoughts and various different positions at this first webinar. And so we're going to begin with Javier Guzman. You have the floor. It's a pleasure to offer it to you. Thank you, Tomas. It's a pleasure to be with you, certainly. And I'd like to begin with the presentation. I think it's important to place in context this whole matter of the health policies in Latin America. And to that end, I think it is equally important to bear in mind some global figures in terms of vaccinations. The different political positions of the countries all recognize the importance of equity in the administering of vaccination. And there were different nuances, of course, access to diagnoses or medicine in general and various other issues did not have, in fact, benefit from the same approach as vaccinations did, or vaccines. Among our pharmaceutical products, it's important to recognize the complexity of the market, but basically the global market has been transformed by the pandemic. We now have here before you the figures that the World Health Organization published this year. 47 vaccines of different sorts, 94 manufacturers of these 47 in the world. That was back in 2021. And as you can see, there was almost a tripling of the doses that were started out in 2021 with 16 billion, went up to 5.8 million more. This was 3 times more, went from $38 million, 38 billion, I should say, in 2019, where today, or at the end of 2021, it was 141. But the COVID vaccines, I think we need to look at very clear-sightedly. Not all of the vaccine markets have evolved in the same way, and we need to consider where the principal growth progress came from. The volume came mainly from the COVID-19 vaccines. And you can see that there were 21 billion that went to it. Let us also consider the element that is slightly transitory. If we ask ourselves, well, who today is focused mainly on the COVID vaccines and what might its future be, the main response is going to be one of some question. It isn't a clear answer. Some have up to 70% coverage, but in Latin America, there is a very different picture than, for instance, we have in Africa, where the coverage hasn't reached 70%. But the point is that interest today is a question of what was very acute and how it will in fact translate into over time. It's important for us to recognize that the political entities in the world did immediately spot the importance of being able to develop pharmaceutical products, and among these, principally vaccines. And there has been a great emphasis on the ability to come up with the necessary vaccines as the need arose. The consensus and one of the lessons learned from the pandemic is that we had all of our eggs in one basket, volume, sure, low cost, but at the end of the day, there was not the sufficient resilience or diversification or the capacity for centralization. And that meant that in a particular circumstance, there was a lack of breadth to step up to the need, say, as occurred in India, where the vaccine output uh, needed to be boosted. So we need to diversify production. Everybody recognizes that. And this means that it's important to bear these things in mind. We have two reports in terms of lessons learned, and it's important for us to bear these in mind as we try to prepare ourselves better for any future difficulty of this kind and the need to diversify production. We speak not only of vaccines, by the way, but of products in general. Of course, the vaccines are the focus of a lot of us, but it's important to look at this from a broader standpoint. We know that in Asia and in Africa, various other capacities were left, various initiatives have left in Brazil, in Mexico, in Colombia, etc. Numbers of the panelists here know this because they have been part of that effort. But the financial commitments are unequal as well. Here you have the results of Clinton Access Initiative giving us a summary of what was learned in terms of public and private monies that were directed towards production and diversification, specifically as regards vaccines. Now, this is not a mistake. Take a look, and if you see something that strikes you, it's that there is no explicit means of financing in the long term that would boost production capacity as much as it needs to be. One of the commitments that is included here comes from the role of multilateral banks, development banks, the donors, public and private sectors, all of which are going to make the difference. And you have to note that there's a great emphasis on Africa for the simple reason that Africa is the region in the world where there was most inequity, a greatest imbalance and unfairness in the access to vaccines, as measured by centers of infection. That's the first point I wanted to say. But the second point I want to underscore here is that you don't really see the money in what we would call strategic areas. We will enter into greater consideration as regards alliances and partnerships in Latin America. But just very briefly, right now, if you take a look at the different partnerships that have arisen, you'll see that Latin America has a good number of them. Different types. Some have been better than others. Some have been more successful than others. That's as it may be. But there have been a good number of these, and therefore the capacity to receive technology and to broaden the scope of different actors involved. The panorama looks very different in different places.
Now we'll be focusing on what are we talking about when we speak about increasing the manufacturing capability. People have different ideas and different concepts, and decision makers have different public policy options. Some want to increase the industrial capability, other ones want to increase the research and development, other ones want to increase access in future pandemics, others want to have a more resilient system for the country, others think in this being a regional good or a global good. If we take into account all of these policy options, it becomes quite clear that not all of them can be attained. And there, of course, certain objectives that are targets that will be clashing with others. The scheme previous to the pandemic, there was one where the efficiency was being improved as well as the price and volumes. That was the entire objective of the previous vaccine market, where there were very important manufacturing points such as India with a slow with small, lower prices and great efficiency. However, this didn't work from the standpoint of increasing access in the case of future pandemics. However, we think that we want to increase equitable access. Clearly, we have to reduce and improve efficiency, at least in the beginning, to compromise prices and be explicit as regards all of these uh, points of balance, the side-offs, as they call them. South Africa made it very clearly when they said that they were paying an additional 15% for products that were being produced in their own country. 15% is the added value they're ready to pay in order to attain that public policy objective. It is important that decision makers, both national and regional, may be clear as to what is the objective, what are these balances between some and the others. We carried out two pieces of work, which where I will be able to discuss, invite you to read them. One that has to do with productive capacity and trends in Latin America and the Caribbean. Another one of a more general nature as to how we could have access, equitable access to products in response to a pandemic. If you look at how this informs our discussion, it is relevant to say that we reached this point because of the pandemic, because of inequality in the access and to products for the pandemic. However, the discussion today cannot be separated from manufacturing capability of the broadened vaccination programs and the health needs that we have in this region, be it chronic diseases or others. There is an amalgam of these two issues because it is not sufficient as a public policy objective to prepare for the future pandemic, especially with due account that we cannot have manufacturing capability who- that is not being used. Any manufacturing capability has to be used in periods of peace or interpandemic. And this is very important as far as these initiatives are concerned. This leads us to say that indeed there are two ways in which you can see these prerequisites of supply and demand. If we think in terms of those of demand, it is obvious that the fiscal space and the budget of countries, the fiscal space to guarantee vaccination coverage for the broadened immunization programs, but also to guarantee preparedness, insurance, and how do we finance a risk which is there and which has not yet materialized. This calls for a clear idea of the lack of vaccines. We don't do that yet as to how we project that vaccine demand. It's only done in the short term. But the creation of long-term capabilities and response capability vis-a-vis a possible pandemic is something paramount in order to have a future protection on a larger scale. There are certain agreements now in force, but if we understand it clearly, one of the essential points is that of guaranteeing an established demand by way of regional mechanisms. One of the great assets in our region are these strategic funds, which were not activated when they should have been activated, partially because they were thinking of a global solution through the COVAX. This led for many countries to have bilateral negotiations. Those agreements are essential in order to guarantee in the long term the sustainability, which is a requirement in order to guarantee the demand as well. The long term, besides, is another essential element. We cannot sign contracts that will be just short term. There's the initial capital cost, the certainty that investors require, because the level of income that must be guaranteed calls for commitments that go far beyond the short term. And this poses a difficulty with the political cycles, the 4-year administrations, fiscal situation we're going through, but that is indeed a pre-requirement. Another essential issue for resolving pandemics. There has to be the capability of signing risk contract and uh, market contracts. We cannot wait for the product to be manufactured in great amounts. This is why many of the countries were lagging behind on that wait list, and many of them did not have access to such vaccines early. From the standpoint of the supply, this is not cheap. One of the estimates, in keeping with the studies I showed you earlier, shows that the Chicago team said that some 60 billion US dollars were required globally in order to have the manufacturing capability, which is necessary. $60 billion is quite a large amount of money. And we think in terms of producing capability. We said almost $900 million for 100 million doses. This calls for substantial capital. We must also have, therefore, a commitment by the private sector. The public sector cannot do it by itself. And this all depends. It's a thing that is done country by country. Some countries have a more developed public sector, perhaps like Brazil, but others have a growing private sector. In addition, we deem that a regional system must be part of a global market. This has to do not just with the actual funding, having access to the financing of SETI, or let us say the new mechanisms which are being discussed on a global basis. It is not viable to think that there could be total pharmaceutical or vaccine sovereignty. There are active principles, there are basic ingredients, and many other inputs that will not be possible to produce everywhere. And this is uh, true as far as the preparing and the guaranteeing of contracts is concerned. Which products are those which are the basis of production? This is a technical issue. And we said in the beginning that we had already started, that many rulers and politicians want to start with the most difficult side, vaccines. 15 years ago, we conducted some work where we're showing for Africa was the global process based on the experience as to how production capabilities were established. But we are following a different approach, which is not a leapfrogging. You cannot jump from one point to another just like that from the historical standpoint. And this poses risks because these are important complexities. Finally, where are these manufacturing going to take place? What countries? How is this non-regional approach going to be followed? It's a point of the agenda we cannot avoid. There are national benefits, regional benefits, and global benefits as well. Lastly, in the work that we carried out, and we see it in the last document, references made to, from the global standpoint as to the relevance of being prepared. We speak globally to 2 points, the first 100 days and the second 200 days, a total 200 days. In the first 100 days, we're hoping to identify the pandemic risk until we have the actual product, the research and development, whose purpose to have a vaccine. This is an objective which is far from being attained. In the case of the last pandemic, this was done in less than a year, which is a historic record. But the idea is that after 100 days, the product will have been developed. The next 100 days are to guarantee the actual manufacturing, the necessary volumes, the procurement, the availability, as well as the continuous supply for the countries. The roadmap here is very clear. In order to couple the regional initiatives together with a global coordination mechanism, how can this be considered with the evolution of the pandemic issue? All of these are important questions. Secondly, we realize that there is no adequate visibility as to the manufacturing capability or the manufacturing needs, which depend on the demand. Some surveys have been carried out globally, but this is done on a voluntary basis. The industry say how much capability they have. This is not verifiable. It is not in real time. It is not at a granular level at a granular level, and how can we be more flexible in that manufacturing capability. The word here is to be prepared and have sufficient information to be resilient, to be flexible, and have different capabilities when the time comes. There must be money, resources available to fund from day zero with the general agreements previously established. And of course, there have to be strategies for this is a key element. Strategy in order to sustain the demand in the periods between pandemics, which are the products which are going to be produced when there's no real need to have a response product being elaborated. Another pre-requirement that we could discuss broadly has to do with the regulatory capability, not just as far as the production in the countries, but regional regulatory capability. The Americas have another added value, which is very important here, which is the referral agencies, that they work hand in hand together in a harmonized manner. That will be important. And finally, the control of the mission. This is an approach which has to do with the actual safety. Um, this isn't national security, this is regional security, and this goes beyond the actual issue of health. To conclude my conclusion, we have a very important window window of opportunity where the political and technical areas are blended, where there are certain demands and the window of opportunity in which we can make progress. However, as of now, there are no financial commitments which are clear in the region. It is difficult to have strategic alliances which are necessary with which we should be working. Of course, there are many pre-requirements that have not been satisfied on both sides, the supply and demand. And we have to work on that, taking advantage of that window of opportunity. The idea is to be prepared vis-a-vis pandemics as an initial approach with the advantages it poses. Will there be money? Will there be funding? Will there be an adequate policy? Will there be interest of pharmaceutical sovereignty? And what are the limitations as well? Clearly speaking, as I was saying before, it is very important to think in terms of regional production or regional pilots for those products. At this point in time, we're working in antimicrobial resistance, and it would be very interesting to have the manufacturing of products in the region for that purpose in one of the countries in the region. Then that could be purchased by the strategic funds of PAHO. I believe that indeed the idea is yes to the vaccines, yes to this window, but manufacturing capability indeed can be or should be more realistic when we think in terms of other products. I thank you. Excellent, excellent, Javier. Thank you so very much for your presentation. You went through practically all the strategic issues that we have underlying this discussion, leaving us with very good ideas to think upon and how to carry out this agenda in the future. I will remind you and announce to all of our attendees that we have over 200 attendees in our room and our webinar today. If you wish to ask questions, you will see that there is a question and answer logo in the lower part of the screen. You can leave your questions there, and then we try to consolidate them in order to give them to our speakers. We have a space for questions and answers after the presentations. Now we move on to Marcela for her to make her presentation. Go ahead, Marcela.
Good afternoon,
I'm
everyone.
switching to English.
As the presentation is being enabled, I would like to begin by thanking Pajo for organizing this session, and thank you for the invitation to share with you some thoughts and some ideas on this very important topic. And it's a pleasure to be here with Javier and Nicola. I hope everyone can hear me well. Okay, so I think during the SARS pandemic in early 2000s, there was a lot of investment in research and development to produce a vaccine against coronaviruses. So this effort, however, did decrease rapidly over time once the perception of that threat diminished. So I think a very important lesson from COVID is that a similar situation cannot repeat itself after this pandemic. And I think this is why this meeting is so important to keep this topic on the top of the agenda. The pandemic, as we all know, exposed critical weaknesses in the ability of our countries to respond to the crisis, and it showed the ease with which the supply chains can be easily disrupted, right, as a result of the concentration of production of key inputs and also because of export barriers. So in this sense, I think the pandemic has sort of like made a case for the need for greater investments in research and development, and also in the production capacity at the local level of vaccines, of medicines, other essential medical supplies, all aimed towards facing future health emergencies, but also to be able to tackle some pressing public health challenges that we all face in our region. Next slide, please. So as we know, the pharmaceutical sector in our region faces many challenges, including lack of diversification, high dependence of producers of active pharmaceutical ingredients, large trade deficits, among others. Just to give an example, I think only 40% of the COVID vaccine doses that were used in our Latin American and Caribbean region were produced in our region, and only 15% of the medical supplies that were used during the pandemic were produced in our region. So I think Javier touched upon many of these topics. I think the important message of this slide is that to expand capacity for local production really requires long-term planning and a strong commitment from policymakers and from all stakeholders involved in the process. So it's really an enabling environment that needs to be tackled in several fronts. So some of the fronts that we have here mentioned is investments in education for the development of a highly skilled labor force, both at the technical front and also at the managerial front. Partnerships with institutions, universities, technology companies for technology transfer, also for knowledge sharing, for skills development. The need for a robust framework, a regulatory framework to ensure the safety, efficacy, and quality of the vaccines and medicines produced locally, as Javier was mentioning. I think when we talk about regional production, beyond just talking about strengthening regulatory agencies, we can also talk about harmonizing standards across countries, for instance, which is an issue that's very challenging to put in practice, but that it could help to build confidence and to facilitate exports as well. Access to finance, right, including capital markets, which in turn obviously contributes to investments in manufacturing plants, machinery, research and development, and also the supply chain. As Javier was mentioning, it's important to keep in mind that the production of medicines and vaccines require many inputs, and that some of these inputs, well, or depending on the import of these inputs, can also in the future, in the case of a future health emergency, limit production. So this enabling environment could consider the production of some of these inputs as well. It all depends on how far up in the value chain countries or the region wants to go. And obviously access to markets. As Javier also mentioned, this is super important. Demand must be there to ensure the sustainability of the production. And then among some other factors that I mentioned. So it's really an ecosystem that we are talking about here to be able to facilitate the sustainable production of health technologies at the local level. Next slide, please. And so how the IDB can support this type of efforts in the region. The IDB group, as you know, is composed of the IDB, IDB Invest, which works with the private sector, and also IDB Lab, which tests innovative solutions for problems of our region. So the IDB group provides financing and technical assistance to support work in the pharmaceutical sector at 3 levels: at the firm level, at the country level, and also at the regional level. So we will see some examples of this in the next slides. In addition, we also facilitate policy dialogue between countries, and we support applied research and dissemination among stakeholders to share knowledge, best practices, case studies, and other types of analysis and studies. Next slide, please. So at the firm level, through IDB Invest, we can support investments in the development, expansion, or modernization of production capacity, as well as research and development. In this slide, you can see some examples. In 2022, 2022, IDB Invest approved over 200 million US dollars in loans to 5 Latin American companies to support expansion of production capacity. As you can see in this slide, some of these loans included an operation, for instance, with Fundação Butantan in Brazil for the construction of an influenza vaccine manufacturing plant, and also an operation with Luminova in Guatemala to support the launch of a new line of non-branded generics. Next slide, please. At the country level, the IDB group supports many activities directed at strengthening health systems. This includes improvements in primary care, healthcare networks, hospitals, laboratories, including physical infrastructure, medical equipment, quality improvement processes, among others. It also includes investments in digital health, an area in which we work very closely with PAHO, as well as human resources and many other areas. I think all of which contribute to ensure that people have opportune access to quality, safe, effective, and affordable medicines and vaccines. The IDB, through its Social Protection and Health Division, where I'm coming from, has an active portfolio of approximately or over 3 billion US dollars for the health sector, in loans for the health sector. It's important to mention that the IDP can also support improvements in the supply chain to contribute to their resilience, as well as improvements in overall infrastructure, including transportation, energy, communications, technology, all of which can contribute towards to facilitate trade between countries. Next slide, please. At the regional level, the IDB really wants to support cooperation and policy coordination among countries to create synergies that can benefit the region. So this is one example of a project that we have worked on together with PAHO that's analyzing the enabling environment across countries from the region, particularly countries that integrate Prosur, to explore the expansion of vaccine production capacity. Next slide, please. And speaking about cooperation, the IDP sponsors a network called the Cooperation Network in Digital Health in LAC, RACCEL, which promotes the adoption of digital health tools and interoperability standards in line with PAHO's principles for the digital transformation of the health sector, the 8 principles. So just to give an example, RACCEL, PAHO, and the IDB achieved a very important milestone during the pandemic, which was a project called LACIPAS, which supported 8 countries to adopt international standards for COVID-19 vaccination certificates. Nowadays, this project has expanded to about 15 countries, and it incorporates other vaccines and other health data. I think this is a very good example of how both institutions, PAHO and IDB, have been working together to support regional solutions, in this case, a digital health solution to common problems of the region, which again ultimately contribute towards pandemic preparedness and health system strengthening. Next slide, please. This is another example of the type of work that IDB can support at the regional level and that contributes towards pandemic preparedness and health system strengthening. This was a grant that supported Belize, Guyana, and Jamaica between 2017 and 2021 to basically carry out key activities aimed at the implementation of international health regulations. And as you can see in the slides, this involved strengthening laboratory capacity, training of emergency and operating centers, and other activities. Next slide, please. And finally, this is another example of the cooperation that we can provide at the regional level. This is a regional knowledge network that supports countries to make informed decisions about what to finance in health with public funds. And this is important because priority setting in health economic evaluations could also support decisions regarding which health technologies to produce in a country or the region. I won't get into many details on this slide, but you can see sort of 2 areas in which criteria works. One, generating knowledge and disseminating knowledge for the countries of the region, and also supporting countries directly. Next slide, please. So here are just some key aspects to keep in mind as we move forward. I think Javier also touched upon many of them. One is that technological innovation has brought a new generation of medicines and vaccines that's ever more costly, right? The fact that manufacturing technology for vaccines and medicines is evolving, including new platforms that must be able to produce commercially viable products beyond COVID-19 vaccines for during the peace times, as Javier was mentioning. And the health emergencies call for a production capacity that's much greater than it is required in normal times or peace times. And so this context, which is evolving, really calls for solutions that can ensure that people have opportune access to health technologies that they need. And this will include, investments in technology transfer, also investments in education and training of human resources, plans to increase production capacity during emergency times, including for drug substance and also fill and finish. And I think another point that's worth highlighting that's not in the slide is that investments in research and development in our region continue to be very low, as we all know, and that it is very crucial to prioritize this area as we move forward. Next slide, please. So I think in conclusion, just to mention that the IDB will continue to work towards the goal of improving health through financial support and technical assistance to countries, leverage the private sector, sharing knowledge, and promoting regional collaboration, and really working together with all our partners in the region. Looking to the future, very important that the IDB and all of our partners increase our support to scale up production capacity for pharmaceuticals and vaccines, as well as research and development. I think it's crucial that we increase our support also to regional initiatives and regional solutions that may contribute to improve access to innovative products. As the last message, I think it's the same way that the pandemic and the response to the pandemic have evolved, our ability to support countries must evolve and adapt as well to their needs and priorities. And we're looking forward to working with our partners to continue supporting the countries of our region in this goal of expanding production capacity of technologies, medicines and vaccines in the region. Thank you.
Muchas gracias, Marcela. Excelente también tu presentación. Me voy a mover directamente, estamos un poco...
Marcela, thanks very, very much. I'm going to move very quickly. I appreciate your excellent statement. But without further ado, I'm going to give the floor to Nicolo Gligo because time is marching on, I'm afraid. Thank you very much, Tomas, and greetings to you all. I hope you can see my slides. I'm bringing this program up. I think you've got it. I think you have it. Have you not? Yes, I think, yes, we can see it perfectly. Thank you very much. That's the moderator. Well, here's the thing. I am going to present this from the standpoint of a general overview of the capacity for production of vaccines and medication in the region. That's going to be the principal focus. And I will conclude with a few words as to the great challenges that have been identified as essential to face and to be able to tackle within ECLAC. It's clear that the pharmaceutical industry is key. This is strategic to our development. And as we look back to the need to quickly produce more medication, vaccines, and otherwise, it becomes evident that you have to have coming in a health policy that will be the substratum for that pharmaceutical industry. But it is also true from an economic standpoint to recognize that while the pharmaceutical industry is one that is very, very productive and more so than the rest of the industry, but it isn't just any old economic sector. It is also very intensive in the use of new technologies, innovation, and development, so that in and of itself, the pharmaceutical industry is quite compelling. The challenge to us all from the standpoint of public policies is how best we can manage to move our public policies so that we meet the health objectives, but at the same time spur economic and health development of a high level. That is going to have a lot to do with our public policy framework coming in. Now, what we have seen in the region is that this is an industry The speaker is trying to see his slide clearly and other things are interfering. He has just explained. I was saying that it's important to understand that there is a high dependency in this region on the production of various multinational companies and therefore on imports from countries outside of the region. That goes for pharmaceutical products as it does for others. 5 times higher than other imports is the figures we have for pharmaceutical products. You can see it right here. The imports in pharmaceutical products is on the green column, and very often 80 times more than than exports. Exports and imports, of course, only give you a small part of the picture. But if we want to look at how innovative medicine is made available, we have to note, therefore, yet again, the importance of imports. And the national companies tend to focalize on generic medicine of low cost. And such generic medicines produced locally also depend on the active agent being imported. So even if it's produced locally, it isn't all of it that's being produced locally by any means. The active agent comes in from abroad. Now, what happened in the pandemic is that we realized how stark that position of dependency is. We see that 9 months after the first country, which was Chile, in Latin America began offering vaccines against COVID-19, again, this was Chile, the question that arose was what percentage of the population had in fact gotten the complete dosage, 1 or 2. In Canada, there was about, Canada and the US, 52.2%. In the European Union, 53%. In Latin America, only 22%. And there was a higher concentration in the more developed countries where there had been a forward-looking purchase contract. If we look at the European Union, the United States, the United Kingdom, and Canada, or Japan, they concentrated 39% on purchase agreements. And that only involved 13% of the world population. We see the progress that has been made with regard to people fully vaccinated. More than 70% of the population in the region got the full deal. But within the region, there were very great differences. Chile and Cuba, for instance, had more than 90% of their population vaccinated, but Haiti only came to 12 or 2% that had been fully vaccinated. If we look at the different productive structures that reflect these issues I've just described, we see that this is very different country to country. We have countries such as Argentina, for instance, where the internal market is in fact served by some 60–70%. In Chile, it's the other way around. Local consumption of medication, whether it's public or private, is supplied by imports. Now, on the other hand, it's also true that companies that produce locally generally are focused on the local market and have a much smaller percentage of exports, except perhaps in the case of Argentina, where there is a quite developed export market. and has been for some time. But in these other cases, we're talking about production at the local level and the question as to whether that production comes from foreign companies or local companies. Now, interregional trade is another aspect to consider. We have a couple of interesting points if you care to look. Only 13% of imports that were registered came from the same region. What does that mean? That means that 87% of imports, where you have great volumes of imports, 87 come from outside the region. Only 13% is in fact generated within the countries in that same region. That 13%, however, it's important to note, is that it benefits greatly the smaller countries more than otherwise. 60% of imports in Guatemala, for instance, come from within the region, from within Latin America. But the bigger countries, Argentina, Mexico, and Brazil, don't import from the region, they import from outside the region. Another point that I think is worth noting, and that became evident during the pandemic, is that the region showed that it had a particular research and development capacity with regard to COVID vaccines. The more sophisticated progress was generated in Cuba, where 5 different vaccine projects were carried out, all of which were brought to a successful end. And in fact, some of them are being exported. But Brazil and Mexico, with Monsina and a Texan firm, are developing a special vaccine, Avimex in Mexico and Butazalin in Brazil. And it was found that in Argentina was also developing a national vaccine and is about to enter clinical trials. I'm sorry to stop you, but we're still stuck on the different productive structures. You are speaking about very different things, but we are stuck way back. I don't think you're moving this. Oh, I see what's happened. Something got caught, and I'm sorry about that. Now we see this a little better. I'm so sorry for this. I was also mentioning the importance of the regional market, where you see here only 13% of the imports of the countries in the region come from other countries in the region. That means that there are imports for the smaller countries that are more important than for the bigger ones. In Guatemala, for instance, 60% came from Latin America and the Caribbean. But the bigger countries, Argentina, Mexico, and Brazil, the percentage of import from the region is very, very small, as you can see on the right-hand side, 2, 5, and 6%. I also mentioned that the pandemic has shown that there exists a certain capacity for research and development in a couple of countries for COVID, in particular COVID-19. And in the case of Cuba, there are more advanced instances of research so that the Cuban population can be served and enough is generated to export. Brazil and Mexico has different vaccines being developed with the technology that is being developed progressively. And Argentina has noted that it's about to enter clinical trials at the national level. CONICET with the National University of San Martin and the Pablo Casara lab are responsible for it. Different experiences in different countries, Chile, Brazil, Ecuador, etc. But it's good to note the support project with WHO and the messenger vaccine, where Biomanguinhos of Brazil was chosen and another group in Argentina, Synergium Biotech, in fact, so that the messenger vaccine could be distributed more widely in Latin America. So varying capacities, varying different agreements that have been carried out depending on the different international treatments.
especially AstraZeneca between Mexico and Argentina. I think there's a misspelling there of the second of those corporations. 21 and the Carlos Slim Foundation to produce the active compound in Argentina and the dosage and packaging in Mexico. In Brazil, AstraZeneca is also producing Sinovac, Chinese vaccine being produced in Brazil. And they have entered into agreements which have been announced with Chile and Colombia, Cancino with Mexico and Argentina, Gamaleya, originally in Argentina, Unión Química, Abdala is negotiating with Argentina and Venezuela, Chilean University with Rey Terra and company, and Pfizer Biotech also has an agreement already with Brazil. If you add up all of
Puppies.
these capabilities, what is being produced, not so much future agreements, but that which is actually being produced. 82.5% of the dosages that have been administered in the region as of February 2023 had been produced in the region itself, except for Cuba. The rest are agreements with corporations inside the region. In case of Brazil, is where the percentage is larger and it's of about 50%. So if you want to have a more general approach, and if you want to support the actual development of this industry with the three policy objectives we discussed initially to satisfy the needs, the health needs of the population, to generate an economic sector that is relevant, developing science and technology, we also have to understand some of the characteristics of this industry. For example, it is very interesting to refer to research and development. If we wish to develop a new molecule or a new medication, the expenditure, of course, is very important. It could reach up to $4.5 billion in the case of a medication against cancer. If we think in terms of generics, the expenses are lesser, but they're important amounts for the purpose of research and development. Also, the intellectual property trademark is important, and the clinical side is the one that takes most of those amounts that have to be invested. How does this affect health? It is highly regulated industry. Regulation organizations are important actors, not just because of the mere impact. And together with this, they're important because they regulate the impact upon health of these medicines, both as regards safety and efficacy. They also impinge on the economic uh, atmosphere of corporations. How long does it take for a medication to enter the market, and which difficulties do they encounter to go into the market, export, and have international trade? This is something we've wanted to highlight permanently. How is it that they can show that these regulatory agencies have different roles to meet, or that could be have an impact on different areas of the industry? On the other hand, this is an industry as well where certain demand may be added. Uh, Public institutions are an important buyer, so the public procurement mechanisms may be transformed by way of mechanisms of incentives and industrial policy. And there's also important economies of scale in the production of medicines, but particularly with regard to generics. With all these elements in mind, it was that we designed what we call the sanitary self-sufficiency program of CELAC, the Community of Latin American Caribbean States, a proposal that was adopted unanimously back in September 2021, and which establishes short-term objectives and medium and long-term objectives as well, with the final purpose of ensuring resiliency. This is why they call it autonomy, self-sufficiency with regard to future pandemics by developing a regional industry for vaccinations and medicines that will reduce dependency from international corporations. These lines of action point toward the elements that I was mentioning earlier, which are six of them. First, to generate mechanisms of convergency and regulatory reconditioning to improve that environment, to have a regional platform for clinical tests, to generate mechanisms of the purchasing of vaccines regionally, to train consortia for the production of vaccines, legislative norms, as well as the mechanism for public procurement. I will not delve into the details of each one of these lines. I will send you a link through the chat so that you can download this plan directly. And to conclude, I would like to refer to some of the learning we have acquired in the implementation process of this plan, which is now in its third pro tempore chairmanship. This was launched when Mexico was the pro tempore chairperson of CELAC, then moved on to Argentina, and at present St. Vincent and the Grenadines is the pro tempore chairperson of the CELAC, and this plan continues to be one of the priorities of the CELAC. Some of the learning within this process had to do with the need to strengthen this requirement of industrial policy to find a cross point between the objectives of health, those of innovation, and those of industrial development. And thus, having this approach from the industrial policy together with the view having to do with the health approach. There's also the self-sufficiency plan that was thought in terms of a regional coordination, but in view of the high regional heterogeneity, we believe that we must necessarily work at the level of the countries individually, supplementary to the actual plan. And from ECLAC, we have started some cooperation projects to help some countries toward the improvement of their industrial policies for the development of the health manufacturing industries. We have to involve technical organizations, multinational, be they such as CELAC or others. These are the decisions, and political support is always important, but we must also be able to involve the larger possible amount of technical organizations in the process and to go to the operational level. To the extent that we may find more specific objectives that will give a meaning to these organizations, we shall continue to make progress in this process. We must also include the private sector. As of now, the private sector has not been actively participating as we would have wished, they should support the working groups that will be established. It is difficult and complex to work regionally. In the case of our countries, we ought to try to work at the level of sub-regional cooperation with the specific projects in the short term that will allow to show this rapid successes so that this process will keep its momentum. Could we come to the conclusion because we're running short of time? This is just my last line. Have initiatives of coordination with other complementary initiatives, such as a PAHO and the platform for the regional production of vaccines, as well as the platform by the European Union last year, in order to have an association between the European Union and Latin America for the local manufacturing of these vaccines and technologies. That's it for me. Thank you, Nicolo. Yes, we are already reaching our time limit, but I would like to allow 1 minute to each one of you to give us some conclusions. Do we have, I wonder, any questions by the audience? 1 minute for Javier, who has been asked to give a clarification as to what did he refer to by speaking about more regulatory capability, and also on the score as to whether there's a demand, technical demand you may have identified for the strengthening of this regulatory capability or for human resources. Very well. Yes, the key issue, the key point here is having better and more regulatory capability. When I say more is that in many of our countries, since we have no production of vaccines or a production of some other products such as PPE, we don't have a sufficient regulatory framework to able to regulate these, guarantee their quality, safety, and efficacy. Secondly, we have the importance of having a regional approach that will be efficient. We cannot do the whole process for each product in each country. Decisions, of course, are sovereign, but an adequate and coordinated review regionally would be of tremendous value. Thank you. Thank you, Javier. There's another question in the chat here for Marcela. Marcela spoke about the IDB's job regarding the elaboration of sanitary technology. Giancarlo Romano, in our audience, is asking the following. Those capabilities and that knowledge from the regulatory agencies or technology evaluation can be um, extended to the realm of sanitary technology production. Yes, thank you. Yes, with much pleasure, I'll try to respond. The agencies of sanitary agencies may have a better horizon. This process might be developed for the region, identifying data for local production, as well as that which has to do with innovation in terms of regulatory arrangements, what is happening in the European Medicines Agency and elsewhere in other corporations elsewhere in the world, and how we could include this regulatory concept, including many sanitary health agencies which are taking care of these activities, but some other activities have not yet been incorporated, and there's a requirement of a space to continue to make progress in this area. Thank you very much for your response. And also 1 minute now for Nicolo, responding to the question, what is the role, thinking of the value chains, their integration, intra-regional trade? You spoke about the importance of trade in our region. What is the role that these sub-regional options may have in order to bolster, to truly strengthen these actions inside the region and in promoting productive capabilities? That was one of the important learnings as part of this process and the work effort we carry out. In order to make progress in regional cooperation and cooperation, it is important to have common elements that will have a meaning for the countries. This is easier to the extent that the groups are smaller. That is the sub-regional space. Rather, we can see this in Central America, for example. The trade of medicines in Central America is greater than in countries like Argentina and Brazil, although they're next to one another and they're big powers, the proportion is not the same. So the possibility of working with this sub-regionally is the practical means of thrusting these procedures, because to find elements common to the 33 countries, they're all ready to work in the same fashion. That would be something very complex to achieve. I'm going around the same concept. Working sub-regionally, I think, is the way to go. Thank you so very much indeed. Now I will move on to Hector without further ado, so that he will close the session. On my behalf, I thank you all for your wonderful presentations. Hector, on the floor. Yes, just to highlight this gratitude. Thank you, Nicole, Tito, Marcial, all the team of MIT and the regional platform for having organized this webinar. At a certain point in time, we had up to 220 participants, which shows and speaks to the very great interest existing in our region regarding this topic. I want to say goodbye without thanking a basic strategic partner, Global Affairs Canada, from the Canadian government, who you help us in promoting ecosystems. All the questions you have asked go from A to Z, and truly they tell us that we're speaking about an ecosystem that goes from regulatory issues, scanning of horizons, how to strengthen productive capabilities, institutional, the individual, the competency levels. This is the beginning of a whole series of webinars that we hope you will be with us again. Thank you all, and we'll see you in a future meeting. Big hug. Take care. Thank you. Thank you so very much. Bueno.
Nos vamos, ¿verdad? Podemos irnos, sí.